Well, it can affect anyone of all ages and of all different kinds. And eating disorder is not just something that typically affects women. It affects men. It affects boys. It affects girls, and it can afflict anybody at any point in their life. Joining us now to talk about how people on the professional side treat eating disorders and address eating disorders with all different kinds of individuals is Dr. Patrizia Jesue from the Nutrition Counseling Center on today's edition of the Megacast. Doctor, thanks for being with us today.
Thank you.
Glad to have you
Thank you
on
for
to talk
having me.
about. Yeah, glad to have you on to talk about this. For those that may not be familiar with the Nutrition Counseling Center, go ahead and tell us just a little bit as we start off about the different services that you provide.
Sure. So, Nutrition Counseling Center is located in Bloomfield Hills, and we also have locations in Troy and Clarkston. And we are a team of dietitians who are all specialized in eating disorders. So, we treat, as you mentioned, men and women, young and old, helping them in their recovery path in their eating disorder journey. So we are all highly specialized. And then we also work in teams of psychologists and physicians and lots of community resources to help folks in their struggles.
Yeah, and it's interesting too because as much as there's variation in the kinds of people that are affected by eating disorders, there's also the same variation in the ways that different eating disorders affect different people or how they end up with this eating disorder. It's not necessarily something that always just happens like a light switch flipping on and all of a sudden they're having some issues with food. These are things that do develop over time and can have quite severe effects. So, doctor, as we explore eating disorders and as we're discovering eating disorders in different people, how do professionals like you then address these begin to address these different issues, given that there's so much variation and so many different ways someone can be led into an eating disorder?
Absolutely. Eating disorders are definitely multifactorial. So we really need to understand each patient individually and the origins of their eating disorder and where it came from for them and what they're uniquely struggling with. Eating disorders have a lot of similarities, but there's also a lot of differences as well. So our job is to really uncover some of that. We treat people in a multi-pronged approach, meaning there typically should be a dietitian, a physician, a psychologist, and then even at times a psychiatrist on the treatment team. And so we're all collaboratively talking and addressing the patient's needs so that we can treat them in the most effective way as possible.
And talk about that collaboration and elaborate a little bit more on that collaboration, because I would imagine that given that there are so many different factors that can affect someone and lead them to eventually develop an eating disorder, those factors also have an impact on that eating disorder, how it develops, how it manifests itself, and those can even change over time. So just how extensive is that collaboration between professionals of different backgrounds to treat one patient at a time, even just one single patient, and have an effective treatment be developed for them in their situation?
Well, it's our belief at Nutrition Counseling Center that it's very important to do that. So we really like to work with members of the community who are willing and able to take the time outside of the actual patient care time to meet with us and talk with us and collaborate. Eating disorders affect the physical body, which is where the physician comes in. It also affects the mind and the psychology, which is where the therapist is valuable. And then the dietitian is really there to support the patient in refeeding and eating in a way that's going to help support their recovery. We know that malnutrition takes a medical toll on the body, and there's, again, the importance of the physician making sure things are okay and monitoring. But we also know that if somebody is underfed, their brain isn't working properly. And so the therapy that they're receiving isn't as effective as it needs to be or can be because their brain isn't functioning well. So our job as the dietitian is pretty critical in helping them restore their nutrition and getting their brain back to a place where their therapy can be effective and helping them in their recovery.
Dr. Patrizia Jesue joins us on today's edition of the Megacast from Nutrition Counseling Center on the program. And Dr. Jesue, you mentioned that brain function is one of the things that can be affected quite significantly by an eating disorder, but there's a number of different other health effects too that someone that's struggling with their eating in one way or another, or a multitude of ways, can have on the body. And especially for those that are at younger ages, those children and those teens whose bodies are still developing, those can have sometimes severe effects, and definitely some lasting effects on their development and on their bodies.
Absolutely. For our younger individuals, basically, when they're malnourished, they're arresting their growth and development. And I always remind my young folks that you are growing and developing up until age 25. And I'm not necessarily referring to height. Obviously, we know we generally stop growing sooner than that, but the brain is still developing actively up until about age 25. So, when we're in a malnourished state, we are affecting all of those body systems, our growth and development. Bones become at risk for things like osteopenia and osteoporosis. Reproductive organs are affected as well. Usually, young women will lose their menstrual cycle. And so we have potentially fertility and reproductive issues down the road. The GI system, so our stomachs, can really be impacted. So we're seeing lots of GI issues. And unfortunately, a lot of those are getting misdiagnosed by physicians as IBS or Crohn's, or maybe you should go on a gluten-free diet and that will help you. When in reality, it's kind of what we would just describe as malnutrition of the gut. And so, unfortunately, eating disorders impact all of these systems. And even for our adult folks who are fully developed and grown, these systems can be at risk as well.
And you can find more information from Nutrition Counseling Center by visiting their website. As was mentioned earlier, they're located in Bloomfield Township. You can find more information on the website, nutritioncounselingcenter.com. Nutritioncounselingcenter.com is their website. And as you're continuing to investigate the factors that have led someone into an eating disorder and begin those treatments, what do some of those treatments look like? Obviously, as mentioned, continued consultation with a number of different professionals on the medical side, but those treatments too, I would imagine, if the causes are multifactorial, those treatments are also going to be multifactorial.
For sure, yes. And I'm so glad you bring that up, because it's important to know that we don't treat people in a one size fits all approach. We really uniquely tailor our treatment protocol and plan to the needs of the patient, their family. Everybody comes to us with a different story and a different background. So we utilize a lot of counseling techniques. That's why we're called nutrition counseling. So we're not just giving people meal plans and telling them what to eat. We're really helping them understand their distorted thoughts around food. Why do they have these food fears? What is it that they fear in eating certain foods or certain amounts? And our main goal in all of our patients is helping them establish a relationship with food that feels at peace. I always tell my clients, you're going to have to eat every single day forever. That's part of our lives. Food is a reality of life. And so learning how to manage that in a way that feels safe and comfortable to you is my goal. And again, we reach that in different ways from person to person, but we utilize a lot of counseling techniques, a lot of acceptance and tolerance. A lot of cognitive behavioral therapy, understanding our distorted thoughts around food and trying to challenge and change them.
And then there's also those, as we mentioned earlier, those long-term effects that come into play too. How do you maintain that over time? Because someone may, be in a state that looks like recovery from an eating disorder, but those factors that led to that disorder can relapse and can have another effect on these people later on in life, and in some cases can lead them right back into the same issues they had before that led them to consulting with yourself and other physicians associated with the Nutrition Counseling Center. And so, Dr. Jesue, how do you then work with the patients over time, or with these physicians over time, to help them not just recover from what they're currently experiencing, but to prevent relapse down the road too?
Yeah, another really important aspect of this, the relapse rates for eating disorders are not great. It's a 50-50 kind of ratio there. And so for our folks that we want to recover and keep them in recovery, We really educate them a lot on what relapse prevention looks like. What are those early detection signs that you might be slipping back into more of those eating disorder patterns? We help our patients identify that times of transition, whether it's positive or negative, a new job, going off to college, perhaps a divorce or a death in the family. Any type of life transition is a vulnerable moment for folks to possibly want to engage back into their eating disorder. We know eating disorders are maladaptive coping mechanisms. It's how people, unfortunately, have learned to cope with distress and discomfort in their life. And so sometimes transitions will amplify some of those stressors and cause the person to want to engage in the eating disorder again. So we really educate our patients quite a bit on how to be mindful during those times of transitions and how to kind of put your extra coat of armor on during those vulnerable moments to help keep you protected in your recovery down the road.
And as we talk about that recovery and even going back to some of the root causes or the factors that lead someone into an eating disorder, so much of our world today is online and in the media. And as much as there's been in the past, these certain ideal body image, ideal body images that have been thrown at us over TV and over movies and in film. Now that's also being thrown at people on social media, and especially young people who are seeing this quote unquote idealistic depiction of what your body should look like. And when, variation comes into play, our life circumstances come into play, and we don't match that, it can be easy especially for young people to feel even more of that pressure, considering how much social media and the web go into their daily lives. Just how much of a factor or how much of an impact does social media, does the continued fragmentation of the media and all those other outside pressures have on people that ultimately can put them at risk for an eating disorder?
Absolutely. I want to be clear in saying that social media and a lot of these images that we see, they don't in and of themselves cause eating disorders. Eating disorders are multifactorial, and there's many things that occur in a person's life that can bring them
Of
to
course.
that point of having an eating disorder. However, social media is not helpful for those who are struggling with eating disorders. And they really can, as you said, paint a very unrealistic picture of what we're supposed to look like. They set these very unrealistic beauty standards that really impact even men. We're seeing more so, not just the female population. And so a lot of the times we work with our clients to help them with social media literacy, just understanding what to look for in social media and how to be more of a savvy consumer and not find yourself going down those rabbit holes where you're going to be left feeling inadequate about yourself and your body. We also remind our clients to set boundaries with their social media. We can't make it go away. It's a part of our lives, and it can be a very helpful part of our lives. But at the same time, it can cause a lot of frustration and feelings of selflessness and inadequacy in our patients. So we teach them how to set boundaries, how to unfollow social media outlets that are not servicing them in a positive way. There's lots of great social media outlets out there that are very body positive and very recovery focused. So we help them find those sources as well.
More information and to get in contact with Dr. Jesue and the other professionals at the Nutrition Counseling Center can be found on their website, nutritioncounselingcenter.com. Dr. Jesue, thank you so much for joining us and diving into what's a difficult topic to discuss, but there's so much that goes into this, both the causes and then the treatments and ultimately keeping people in recovery. We appreciate your insight.
And I appreciate you bringing awareness to this very important topic. And thank you so much. It's been a pleasure.